ever felt uneasy or anxious about internal pelvic exams? Well, valid. That may be exactly how your clients are feeling when they come to see you. And so today we're diving into our personal process and personal experiences, ways of enhancing bedside manner for internal pelvic exams. And we'd like to make every exam comfortable and empowering experience for you, but also for your clients. Stick around because your clients deserve compassionate care, especially in sensitive moments like these. Okay, and today we have a little agenda to stick to 4 key things to discuss. One of them being creating a very comfortable environment for the room and the plinth setup, effective communication before and after and during treatment, what that could look like, what we struggled with as new pelvic health PTs, and what our anxieties were about in that first year of practice or very first vulvodynia client. And what we found was often missed when it comes to mentoring new pelvic health PTs or PT students. And when what we hear our clients' experiences are with other pelvic health PTs that they've seen in the past. So yeah, we're really excited to dive into this. So let's start. How do we create an environment that's comfortable for the clients as they're coming in for that first internal exam? And I think we also need to like validate that the first meeting is not always the first time that they might experience the internal exam, right? So yeah,
Yes.
tell me a little bit about like how you set that up for the clients.
Well, I think my room in the clinic is a little special. So I have a room that has like lights that like it's really dim lights. So it's not those like very bright white light that
Awesome.
you feel like you're like really being observed under. So I think the
Yes.
lighting actually probably helps. Like a lot of people when they come into my room, they're like, oh, this is really cozy actually. So I think that could
Yes.
definitely make people feel a little more comfortable, especially when you're consulting for a matter that's actually could be embarrassing or could like be making you very uncomfortable to consult for. So I think that would help.
Are your
Um,
clients looking up as well? Like they're completely supine, or are they kind of propped up a little bit by pillows as well?
so during the assessment, it really depends on their preference. So I
Okay.
have like double pillows. If ever for some of those who are not comfortable lying completely flat, then yes, we can definitely have 2 pillows to get them a little prop up. But for those who are fine just like lying flat, usually it's like 1 pillow and looking up.
Okay.
Yeah. Do
That's
you do it
that's really
differently?
I do it similarly, but I feel
Hmm.
like the lighting is specifically important for those who are most comfortable lying in supine, right? Because like they
Mm,
could be staring at super glaring bright office lights, and that's really, I don't know, either like migraine inducing or like really just uncomfortable
yeah,
um
definitely.
to stare at for potentially like a 20-30 minute internal
Hmm.
treatment.
Yeah.
So keeping in mind the lighting and yeah, unfortunately, that might be like a discussion with the manager and figuring out how to change that up is really, really important, actually.
Hmm.
Yeah,
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 you could always get like a like stand-up light. So
true.
if
Yeah.
in your room you have like one big light that's on the ceiling, maybe just getting
Hmm.
like a stand-up light so you could turn off the one that's on the ceiling and
Totally.
just use the
That's
stand-up
a great
light to
idea.
make it better. Yep.
Yeah. I feel like I'm picturing that IKEA lamp
I
from
know, me
the
too.
2000s. That's like $60. You can just pop it in. Okay. Let me see. What else? What else can we be doing to create a comfortable environment for our clients?
Well, I think I like privacy is definitely very important. So
Yeah.
obviously I will like when they are getting undressed, I will like step out of the room to give them the time to get undressed and then to so that they can like have time to comfortably lie on their bed and like set up the position. And I also have like a sheet or like a cover that they can put on top of themselves so they feel
Nice.
like a little bit more private.
Yeah,
Yeah.
because once we're internal, I think a lot of people don't know that once we're internal rectal or internal vaginal, we don't need to necessarily see what's going on at the perineum at all times. So they could be fully covered, especially if it's a colder room that you're using. So yeah,
Mm-hmm.
having that kind of drape over is
Mm-hmm.
really necessary. Yeah,
Yeah.
nice. It sounds like our setups are pretty
Right.
similar for that.
Okay.
Yeah, like I always have a little extra drape and explain what that's for. I there was one time where I forgot to explain what the drape was for on this person's initial visit or initial internal exam visit. And I opened the door and they were like wrapped up like a mummy
Oh
in
no.
in the sheet with no clothes on, like from all the way from like top to bottom. And they were like, okay, what do I do now? I'm like, oh, okay, I did not explain this correctly. You need to
Oh,
rework this, throw on something up here, and then
oh.
yes, so
Okay.
definitely,
That's a funny
yes,
one.
that leads to our explanation. Yeah, I was like, what are you doing? I think I even said like, oh my gosh, what are we doing? What are you doing? And then I closed the door. Oh, that was not good. That was not good. Um,
But yeah,
let
I
me
think in
think.
general, like clients do appreciate having this drape. They're like, I think some of
Yes.
them told me that it really made a difference because I think
Oh,
they've been to maybe like their doctor's exam or like somewhere else for a gynecological exam where they actually didn't have the drape. And they were like, oh, I really feel like very
oh,
just like naked without it.
yeah. And I mean, the drape could be different materials as well. Like I know
Yeah.
when I see my pelvic health physio, it's this kind of one-time use. I can't even describe it. It's like a bubble material. It's a thin paper sheet that's quite
Mm,
small that just about covers me and my leg, like up to my knee. Whereas in my clinic, we use like a
yeah.
washable sheet, bed sheet for that.
Yeah.
Yeah, that
Us
can
as
cover much
well.
more. You as well. Yeah, so it's
Mm-hmm.
reusable. Yeah. What if it was this
Mm-hmm.
person's first time? How would you set up the environment differently for someone who's doing an internal pelvic exam for the first time? Like, do you have the models out? Do you have the gloves and the lubricant? You're like, hey, these are latex-free gloves. Hey, this is a water-based lubricant. We're going to be generously using this. Um,
Mm-hmm.
and like, do you have a whole discussion previous to create that comfortable
I
environment?
I I I actually I wouldn't do like a very detailed explanation about it,
Okay.
but yes, I will like wash my hands in front of them and then like put the gel out in front of them and then show them that I'm wearing my gloves and everything, like to show that the hygiene side is like taken care of. And definitely I will also tell them, yes, we're using a generous amount of like lubes if ever or like gels if ever like you have pain or if you're worried about having pain with the internal exam. So yes, a lot of reassurance as we
Yeah.
go.
Yeah.
Yeah.
Yeah, I find my approach is then kind of different with yours in this
Mm,
respect, where I really like that you don't overwhelm the person, like, this is this, this is that. I find sometimes, though, my clients are more like, sometimes they do appreciate more information because then they're like, okay, this person's considering like that I'm not allergic to this product and this lube seems to not irritate her other clients. So I feel more at ease if it's
mm-hmm.
never given anyone else any like vulvar irritation, especially for
Mm-hmm.
my for our clients with vulvar skin conditions. That can be really
Yeah.
reassuring. So yeah, I feel like I'm probably the type of practitioner that like maybe over explains things a little bit more just to gain trust and confidence and
Usually in
yes,
our
yeah,
clinic we use like latex-free gloves. Like
yeah.
so
What
I think
are you
usually
guys vinyl or nitrile or I forget what we use actually.
I think it's vinyl.
Okay.
Like those like powder free, like latex
Yes,
free.
definitely
Yes.
powder free.
Yeah.
Yeah. Yeah, no, it gets too messy because oftentimes I'm switching my gloves in between the external superficial like muscle
Yeah.
check or like taking a look at perineal scars and then switching my gloves again for the internal and
Yeah.
obviously switching my gloves again for the rectal. So yeah, there's a
Mm-hmm.
lot of glove switching. You definitely don't want one with powders.
Powder. Yeah.
Yeah. Yeah. Okay. Okay. So I think that covers creating a comfortable environment in the room. I think also what is kind of interesting, and do you guys in Quebec get something called the PISA exam? PISA?
Huh.
I don't even know what it stands for, like practice. PISA exam is specifically for Ontario physiotherapists to be on
Oh.
top of their college guidelines, like standards, be on top of
Oh.
like the new knowledge of like, oh, what not to post on Instagram, and like what happens if your client does this, and what happens if you're having an ethical dilemma with your boss. So we basically take this
Hmm.
test annually. And recently, on my last PISA exam, they had mentioned that for specifically pelvic health exams, you could actually have, because you said something about privacy, you could actually have, I think from my understanding, a little bit of space or a little bit of gap in between, like from a full closed door to like a partially open door, which when we first started as pelvic health physios, at least I remember, because Cindy and I, we both were at McGill, we both got educated by Claudia Brown. I remember her saying, like, no, you absolutely need like a firm closed door to practice pelvic health physio. You cannot practice with like a curtain. You cannot practice with like open space.
Mm-hmm.
Um, right? That's how I
Yeah.
remembered it. So I got the question wrong on PISA. And I was like, wait, what? You can have a partially open door? Because I think it was like a considering like a trauma case or considering
Oh.
a client who has experienced trauma, for example, they may feel more comfortable knowing that the door is never going to be locked. It's always going to be open. There's always going to be an escape or like a place to go without the practitioner in the way. So I thought
Mm.
that was interesting that that may have changed within our years of practice
Yeah.
as like creating a comfortable environment.
It is actually
So
very interesting.
yeah, so that's something
Mm.
that you kind of triggered in me when you said something about like it's important to have privacy, but it may also be important to like create the environment of like there's
Safe.
space to like escape if you need to, or like like if you want to
If
leave the room, you could.
Well, I
Yeah,
guess
like
that's
create that.
their way of feeling safe, right?
Yes, correct.
Yeah.
Yeah.
Hmm.
Yeah. So that might be something to explore. Like obviously in a clinic where there's a lot of high traffic outside your door, that's probably less likely and more distracting, right? Too many noises,
Yeah,
too much going on. Someone could walk in.
exactly.
Um, but if it's like a door that could be a little bit like teed out to the side of the corridor, maybe like a little sign could be put there, like
Mm,
exam in
right.
progress or something. So just thinking out loud of ways you could make this work for
Mm-hmm.
a client who has a history of trauma. Yeah.
Mm-hmm. And I guess
Um,
definitely when
yeah.
you're lying your client on the bed, you don't want the client to face the door. You want to face away from the door.
Mm,
Also
sorry.
depends how
My
your room is set. It really depends on how the room is set up, but
yeah.
like, you know.
Well, I'm just picturing like someone swinging the door open. And then, like,
Oh.
yeah, that's interesting. That's actually how our room, yeah, how our room's set up. I think that is how our room's set up. Yeah.
Mm-hmm.
Um, but also you may need to move the furniture around, right? Because like
Mm-hmm.
keep in mind, I think this is also something new pelvic health physios need to hear is that you may not be doing the internal exam always in supine or like crook or like semi what's this
Incline.
called, semi inclined. You may be doing an internal exam like in lunge standing, or like if someone needs to be side lying during their third trimester, they feel more comfortable that way. They may be side lying. So you may need to move things around. And so making sure that that's a possibility, or maybe getting help to move things around, knowing your client's preferences before they even walk in, so that you've gained that like kind of like, oh, she remembers to like push the plinth closer to the wall because I like to have some security that I'm not falling back or something and side lying. Like people love that. Like they find comfort in you guys knowing their own preferences. So
Definitely.
yeah, so definitely don't be glued down to like every internal has to be lying on your back. Not
Hmm.
necessarily, not necessarily. Some maybe in all fours. So yeah, definitely open your mind up to potentially performing an exam that way. Let's move on to how to effectively communicate before, during, and after treatment or the assessment.
Right.
Any quick pointers, or how would you approach communication
So
for before?
so before any internal, like especially if it's the person's first visit to come see you, and then it's their first internal exam with you, like it's always important to explain to them why you are doing this, why, like what information by doing the internal exam is going to give you in order to help them. And it would be very important and very helpful if you like have the pelvic model and then explain to them
Mm,
the anatomy, where is the pelvic floor located and why, and showing them that's like why maybe I need to do the internal exam, because that's probably the only way for me to effectively evaluate your muscle strength, endurance, capacity to relax, and all of that. So just by educating people, I think that will give them a better idea of why you're doing this. It's not just like doing it for fun, but it really serves
mm-mm.
as a
Yeah,
purpose, and it could be a
yeah,
very crucial part into helping them solving their pelvic floor dysfunctions.
yes, yes.
Yeah.
I find that's especially so necessary to like have a chunk of time just to explain it, especially if they come in shocked. Like they're like, "Oh my gosh, I did not know." I get that question
Mhm.
where they're like, "What do you mean internal exam?" And they're completely blindsided by that and they're completely
Oh
poker
yeah.
face, but inside they're internally freaking out.
Yes.
Um, so yeah, you can generally tell when someone knows if there's an internal
Hmm.
exam or if they're like, crap, like I don't know if I'm
And
coming back. So
And
yeah.
sometimes it's really funny because in our clinic, we usually send people like for them to complete their health questionnaires online, and also like a
Okay.
consent form for like saying if you consent to have
Oh,
like the pelvic floor exam. And some people they find it and then they come in, they're like, oh, there's the pelvic floor exam. So that's why, yeah, never assume, just
oh
always
my gosh.
explain and always ask for consent at, like on the spot as well
On the
to make
spot.
sure that your
Yeah.
client actually understood what they're coming here for. So.
Yes, 100%. Because who has the time to read consent forms anymore? Um, I put down something similar in terms of like gaining consent. This kind of takes me back to like when I had to take that awful exam. Um, but you had already mentioned some of the benefits of getting pelvic health exams. I would also include things like what exactly the exam entails. I think you mentioned this as well. But like I go crazy in detail, especially if
Hmm.
someone's got that reaction of like, holy crap, internal exam. I literally explain everything from like what to do on the outside, what we're doing on the inside, how it's draped, um, how you can change positions, how they're completely in control of the situation, how every movement of the finger is intentional. So a lot of detail examination, and I think most of my clients are pretty appreciative and they can make an informed decision after that.
Do you do
What
all that? Like that's like the speech you give before you do the internal.
Sometimes that's the speech I give in
Okay.
the initial assessment near the end.
Hmm.
I don't, so this is something Cindy and I talked about before, but I don't typically do an internal exam on the first visit. And I'm probably going to get some like negative comments on this, like, what are you thinking? You should do it on the first. But I find there's so much important subjective information. I do not want to skip or I do not want to like gloss over certain details of the subjective interview because that is probably going to give me the answer of like what is truly the source of their pelvic floor dysfunction. So I spend a lot of time questioning, the gynae history or the men's health history, the bladder, bowel, sexual health. the jaw health history, the medical stuff. So I spend a lot more time on that, and I get through my external objective assessment all in the first. Unless the client comes in and they know exactly what's going to happen, they've seen one of us before, and they're like, "Oh, no, 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 no. I want you to make sure you get an internal assessment in today." That's the only time I will make sure to carve out some time for the internal.
Mm.
What about you? Do you perform the internal right away and like kind of skip a few questions, or like,
It really depends. Like I would
yeah,
say it
yeah,
really depends because I
yeah.
think some clients can have a complicated history and that
Yes.
takes the subject like that
Yes.
makes you
Yeah.
like spend so much time on the subjective part. But I also
Yeah.
agree that it is important to get like every information because that also helps you making your diagnosis, knowing like how I will like actually perform my test, like which test I will actually choose during the objective assessment. So definitely, I think getting the subjective part is important.
Yeah.
So yeah, it really depends on the case. I think for
That's
some
a good
like
point.
simple cases, I can definitely get to the internal exam on the first session. And obviously, if they are
Mm,
okay with it, and there are clients
yes,
who are also not comfortable having the internal on the first one, they're like, maybe
for
let's
sure.
wait. Like, and then obviously we'll just do
Yeah.
everything externally, making sure that every outer like muscle connection to the pelvic floor is all right before we do the internal exam, and that's also fine. Yeah. So it all depends.
Okay. That's a really great point. Yes. Valid. It's like complicated histories. It's not the client's fault, of course, but yeah,
No. Hmm.
it can take a while. Um, the other things I had in gaining informed consent is you also want to let them know, like, well, what are the alternatives? Like, if I really don't want to go through with this internal exam, what are the
Hmm.
alternatives? And I think what's really unique about this is during COVID, we built a business on doing virtual pelvic health PT. And we gained a lot of insight on how to assess over camera, which is non internal, by the way, or not even like clothing. There's clothing stays on, so we have a few strategies on how do we check the pelvic floor in an external kind of manner. Or the alternative could be, could we give you some instruction for like you or your partner to kind of explore this on your own if it's an absolute no in the clinic? So, I mean, there are so many different alternatives, and that could be communicated as well if
Yeah,
it's they're really on the fence. You
absolutely.
mentioned what are the benefits, what are the risks, right? I guess like one of the question I was really curious to ask you is, have you ever had an experience where someone had like a really terrible flare post internal assessment? Because it
Oh,
can happen. It can happen, and that's always a risk. But how often does that actually show up in the clinic?
I would say it's not very often, but I
Yeah. Yeah.
think I now when you ask it, I think I did have one, but it was not because of it actually wasn't the first internal exam.
Oh, it
It
was
was
on a
actually
subsequent exam.
exactly it was more on the subsequent
Oh,
exam.
okay.
And and then I think afterwards she had a bit like she had more discomfort in the area down there, and then she had like more difficulty peeing because her pelvic floor was like tight and they were
Ah,
like reacting to probably the exam and then like the treatment we were doing. So yeah, she got like her I think her pelvic floor muscle just like reacted into like contracting more. But I think that was
mm,
probably the only flare up I had post
okay.
perineal exam. Yeah, usually my clients are pretty okay. They didn't like report any like discomfort. But yes, that's definitely like risks are definitely there, and we all like write about the risk and the consent form so people can read about it
Oh,
as
so
well.
that's really interesting because our
Yeah.
clinic, yeah, like your clinic has built that into their internal system. Our clinic does not do that. So we actually do have to take the time to go through these
Hmm.
points. So that's probably, yeah, something interesting we could change actually. Um, Yeah, it would save me time for sure. I'd probably have to reiterate, but yeah, it would save some
Yes,
time, I think.
because not everyone reads like you said. They sign
Yeah,
it without reading.
yeah, that's true. That's true. Something to think about. So
Mhm.
yeah, what are the risks? Oh, sorry. For me, it's very rare. Like I think I can count on my like less than five
Mhm.
over 7 to 8 years. Um, yeah, very, very little. And funny enough, it was one of the cases I had. Um, she had mentioned that, yeah, something urinary. And she was very actually quite like concerned about doing the internal exam. So this person, I had seen them probably 10 times or so. And then she was like, you know what? I trust you. I obviously trust you. I've been back 10 times. I'm ready. I'm ready for the internal exam. And so we did it. And I'm not sure that her body was ready or something wasn't ready. And like you said, like she probably reacted to the treatment and like wasn't able to fully relax. I just kind of tensed as I was trying to release the pelvic floor muscles. And afterwards, I mentioned like a slower stream or a deviated stream,
Yes.
right? Which can indicate one
Yeah.
side is tighter, a deviated P stream that's hitting like the toilet bowl. So yeah, like sometimes people aren't ready to have an internal exam. There's no point in belaboring like how great it is if they are not ready, right? You could
Mhm.
simply create some concern or create some issues or yeah, or just assess and have a bunch of false positives. Like you could just be like everything's tense, and then like what's the
It's just
point of that
because they're
exam?
scared. Yeah.
Yeah, and they're just guarding, right?
Yeah,
So
exactly.
yeah,
Mhm.
recognizing when your client is ready. Oh, yeah. And the other thing is like letting them know, reassuring that they are, again, in the driver's seat at all times. So if they want to go a little less firm, a little more to the left, a little more to the right, one finger, two fingers maximum, right? Like I
Mhm.
don't do more than, I think we're trained on two fingers maximum. Um, they can choose what position they get to be in. Like they're always in the driver's seat. If they want to stop at any point, we're done. So
Yeah.
letting them know that before getting started is really empowering for your clients. So definitely at least hit that point, um,
That's
so
a
that
very good point.
they're in
Mhm.
control. Okay. Okay. Let's go on to the next point, which is communication during treatment. A lot of just like, how are you doing? How does
Yeah,
this
checking
feel?
in with your clients, definitely.
Yeah,
And I think sometimes I will like also describe what I'm doing as I'm doing it, like guiding them.
that's awesome. Yeah,
Yeah.
I find what I often say a lot is like, does this remind you of something? Because also that can guide me into like understanding like, oh, that might be triggering their urinary urgency, or oh,
Mm,
this spot is their deep dyspareunia area. Like, oh,
mm,
that feels like I'm in doggy, or like, oh, that feels like that awful thing that's like radiating to my hip. You start to
mm.
like understand like, oh, this might really be coming from a pelvic floor dysfunction.
Yeah.
So yeah, asking if it reminds them of anything instead of cueing is really important. Before I forget, some of the like down training things, right?
Oh yeah, the
Yeah,
breathing. Yeah.
breathing,
Mm-hmm.
visualizing this
Yes,
invisible, like hidden muscle
that's
expanding
true.
or vulvar blossoming.
Mm-hmm.
Um, Sometimes I'll even stop the treatment and be like, let's just take a couple breaths.
Yes,
Yeah. Do you ever use the pain scale to be like, hey, if we're ever over 3 out of 10, you got to let me know we're stopping?
I
Or like,
do.
what's your marker for that? Yeah.
I
Three as
yeah,
well?
it
Or what do you?
for me it's like 4 on 10, but again, it's very
Okay.
subjective, but yes, I will I will use that.
Scandalous. Or she's a monster, people. Oh,
How do you distinguish a 3 and a 4, Jane?
oh, man. I know. There's
Like,
probably a study out there like 1 point off. Radar reliability is okay. Yeah.
But yes, we definitely use the pain scale so that if ever it goes beyond that, then yes, let's stop, let's do something different, let's maybe go back
Yeah.
to breathing and just
Okay.
yeah.
Okay, really good. Okay, what about after treatment? So you've left the room, they're changing, they know where the garbage can is and they know where
Hmm.
to get their yeah, what do you guys do by the way? Do you use wipes or
We
Kleenex
have
or
we have Kleenex.
okay,
We
so do
use
we.
Kleenex. Okay.
Okay. And a separate wastebasket or together with wastebasket with the others?
It's the same waste basket.
Yeah.
Yep.
Honestly, I don't even maybe if someone who's a pelvic health physio could drop in the comments, like, are we supposed to be using a different wastebasket? Drop it down in the comments because we've been using the same one. The same one. What did we
Yeah.
have anxiety with in our first year, our first few patients? Do you want to start us off, Cindy, or
I
what are
think
you
I was
thinking?
more like I think I was more anxious about having patients who consult for pelvic pain
Ooh,
about like doing internal exam for people who is scared of having an internal exam because I
yeah.
think when you just
Mm.
started as a pelvic health physio, like I feel like that's all that you were taught in your course. Like you have to do a pelvic floor exam for your clients in order to
Yes.
know when you're like treating what the problem is. And then when you have your first pain client, they tell you that I don't think I'm ready for this or that I
Yeah.
like is it going to be painful? And they ask you this, you're like, okay, not
Yeah.
sure
Oh
what
my
to do
gosh,
now.
so valid. Do you
Yeah.
guys I almost want to ask our audience if they feel that way, like if the messaging is still the same. Because we took our first pelvic health course 8 years ago, 9 years ago. And the messaging was
Hmm.
very much around like, you need an internal, you gotta do the internal. It's the most important thing, the most important treatment, everything internal. I don't know if that's the messaging anymore. So if someone who just took level one, level two, or the equivalent in their region, could you just put in the comments, like, is that messaging still relevant or is it like more holistic or more like the internal is one tool. There's multiple tools in the toolkit. So yeah,
Hmm.
let us know if that's still relevant. But I feel you that was totally the messaging
But I
back
think
then.
also as a new like physio that just graduated, you don't know
Yeah,
that many techniques either, so you're kind
that's
of like stuck.
okay. That is probably the crux of the problem. Yeah,
Yeah.
that's the problem. I only know how to treat you internally. Help a sister out. Yeah, that's probably the issue. I don't know, like maybe the level one, two, threes and pregnancy postnatal should just all be encompassed together instead of separate courses. And
Hmm.
I think that's like a big issue because at least in Ontario, we're offered this course as like a weekend course and they're like, we've given you, enough information. Let's go start practicing. And I felt like honestly really nervous in the beginning to start practicing. And that's with saying, um, with also having Claudia Brown's in female incontinence course taught at McGill, and then to take the female male incontinence course taught by PHS. Like I was still pretty nervous, to be honest, to practice. I like specifically remember my first female. I specifically remember my first male internal experiences and they were rough. Like I was scared of messing up. I was like, what
Oh
if
yeah.
I accidentally go into the wrong hole? And they're like, oh my gosh, have you not ever done this before? Like I was so scared that they knew that I knew that I was like a newbie. I was so scared about that.
Oh, that
Yeah.
is definitely true.
And of course, like my first female client, she came in with like a big, like right-sided Bartholin cyst. And I was like, oh my God,
Oh,
why? Why is this my
on
first
top.
ever client? And I was like, I don't know. I don't know if I should do this. She's like, my doctor knows about it. I'm pretty sure they said, like, "Go ahead." So, like, I think you can go ahead. And I'm like, "I don't know. I don't wanna be sued. I don't." I'm like, "I'm really not sure. Can we, like, save this till next time?" Honestly, I don't think I ever saw this person ever again.
Oh
So,
no.
like, we're gonna have moments like this. Like, let's just be real. Like, sometimes
Oh,
you don't know. If you're not sure, like, just yeah, I would say go with your gut. And my gut was telling me, like, don't do anything because you're not sure what this even is. Like, I didn't know it was a Bartholin cyst until I was like Googling
Googling
after what the
after.
heck is what is the wart that's on the right side? What the heck is that? Yeah, so
Yeah.
like, if you don't know, don't do anything, consult with your mentor, come back to it. But
Yeah.
yeah,
Just
it's
don't
scary.
harm your patient. That's the
Don't
first rule.
harm well, yes, don't harm your clients. Yeah,
Yeah.
yeah. So that was scary. So
Mm.
if you feel scared, if you feel nervous, this is completely valid. Like, you're basically picking up a new skill, and this is in a very, like, for us now, we're kind of so used to it that it's like this innocuous thing that we do now. But at the beginning, I was highly super sensitive about, you know, asking someone to change and throw on the sheet. Like, now it's just like routine, routine, routine.
Yeah.
But initially, I'm like, this is really scary. What do I do? So,
Mm.
yeah,
Especially if
um,
you are the only like pelvic health physio in your clinic and
yes,
you have like
so
no one to
isolating.
turn to and no one
It's
to
so
like mentor
isolating.
you, it can definitely be
Yeah.
scary just like coming out from the courses you've taken and to like
Yes.
start like directly with your client. Oh yeah.
Yes. So valid. And like I said, some of those courses are pretty short. So reviewing your notes and things like that, it can just seem daunting, like, oh crap, I don't remember. I took this 2 years ago. I don't remember how to do that maneuver. I don't remember how to check where the heck is superficial transverse. So if you guys are confused about how to actually perform the internal exam, including like taking a look at the external, what the heck you're looking for, then we invite you to join our Patreon club. It's called the same name as the YouTube account. It's called the Stubby Nails Club because we have to cut our nails to stubs to do the internals. And we invite you to join our monthly membership with content like this, educational content, and personal experience stories to, yeah, hopefully enhance your practice and get you growing to a full caseload sooner. So, yeah, we will be showing you exactly how to perform a female and male internal exam on our Patreon account. So, have a look. We'll link it in the description box below. Okay, final point, guys, is what is often missed in the internal exam? Cindy, anything you've noticed over the years?
I think from
Mm.
personal experience and from like seeing my student who also just took like the first pelvic floor course, I feel like when we just start and as we're doing the internal exam, we're like so focusing on like, okay, let's do a pelvic floor contraction, let's do a maximal contraction, let's do a fast contraction. And we don't, I feel like sometimes we really lack the ability to feel if patients are fully relaxed or not. I know that when I started, I definitely neglected this part. And it's like really with the times and like with more experience, I know that, oh, someone is actually not relaxed fully. And I actually
Yes.
need to guide them
Yeah.
to relax more. It's not just like a small relaxation, it's really just like going into like the full relaxation. I think that was definitely something I didn't do when I first started doing pelvic health physio. And and I think yes, I think also the breathing, the piston, that was not something when I started, that was definitely
Mm.
something that I didn't do either at the beginning.
Do you mean, sorry,
Like
when you say piston,
the
assessing the breathing
diaphragm,
or
yes,
ass-
like oh well, not definitely not assisting it, but like just to like iterate how important it is to the client and
Oh,
actually like
okay.
practicing it with the client and using like the
Yeah.
diaphragm piston to help with the pelvic floor. That's also not something I did in the beginning.
Okay.
Yeah.
I like that. I like those points. I like how you mentioned the not knowing if it's a full, like if they're fully relaxed. I often found, and I don't know if you feel this too, but sometimes when I have the first session that is the internal exam, there's like this baseline level of like guarding. And
Yes,
then the
definitely.
second, then the second session, internal session, they like trust you. They've gained a level of trust where they're like much more relaxed. And I'll be internal and I'll be like, "What did you do?" And they're like, "What do you mean?" And I'm like, your pelvic floor feels really different from the first, like in a good way. And it's like much more excursion is available. There's much more flexibility.
Yeah.
What did you do? Like, what did you do? I don't recall like giving you so much to do in between this week to next week. Do you get that where you're like, what
Yes.
the heck? Their pelvic floor feels totally different.
Uh-huh. Yes,
Yeah, and I
I
think it's the
do
guarding,
think
right?
exactly, and
Mm.
I do think definitely that the first session people can be like more scared. They can
Yes.
like they have more
Yeah.
difficulty to relax because of the guarding. So yeah, so but I do take that into account. So I'm like first session, it's
Okay.
okay, you're doing the best
Yeah,
you can. And yeah, and I do get that the second session they're like, oh, it's like much better.
for sure. I mean, like, as much as possible, I'll try to see if I can down regulate their nervous system in that first session, but sometimes I will still see that dramatic difference. Yeah, but it's interesting that that happens to you as well. The other
Hmm.
things I would say for like new pelvic health PTs is I find a lot of people are really anxious about the anorectal exam, or like they just don't
Hmm.
know what to do. They also don't really don't do at all, or like was never taught superficial muscle exam,
Oh yeah.
superficial, what am I saying? Superficial muscle examination, or they'll like, they just don't check. They don't check the sacral dermatomes. They don't check. I hope they're checking. I don't know if they're checking the anal wink. Um, Anyways, all of that stuff will be in detail in the Patreon account, and you're going to be talking about the perfect method, right? Or the perfect,
Hmm.
the acronym PERFECT
Yeah.
method that we learned at McGill.
Hmm.
Um, okay, so yeah, all of those details will be in our Patreon club content. But those two things, I cannot tell you enough. Like clients that come see me as a secondary or third pelvic health physio, they're like, what are you doing? Like, what is this dermatomal testing? What are you pressing down there? What do you do? Like, why do we need an internal rectal? Like, do we have to? I don't know. I don't know if I feel comfortable about internal, like, anal rectal exams. And so I don't know. It kind of surprises me that people aren't doing it enough. I know this is something that, if you guys follow Nicole Cozine's amazing podcast, they talk about this one a lot as well. And I don't know, do you find the same thing when you're like the secondary provider? You see that they're like, oh my gosh, I've never had an anorectal exam. What does that entail?
And I think it really depends on the case as well. But I do like had a colleague who does pelvic floor, but she is not comfortable with rectal. So whenever she has a case that she thinks that like an
Would
rectal exam has to be
benefit?
done, she will send like the person to me. So yes.
Yes. Yes, and what are those cases? So tailbone,
Yeah, tailbone
rectal,
pain, yeah, fecal incontinence or like really more fecal problems.
yeah,
Yeah,
digestive, rectal
like constipation,
problems.
digestive, yeah.
What else? Anything else you can think of off the cuff?
I think that's the ones that I see most often for anal rectal exams though. Well, male obviously.
Meh. Yes. Yeah.
Do you
Digestive
have
in nature.
anyone else that you see that you do an anal exam with?
I do. Honestly, I not request it. I offer it to almost all. Actually, and especially if pregnant, because if we're looking for grading a rectocele, oh yeah, that would be one, grading a
Oh,
rectocele. Um, you'd want to know someone's baseline. So if you're not routinely checking it, um, yeah, you just don't know. And the fact of the matter is, I think as a new pelvic health PT, I was really concerned about people thinking I was weird or something, or like having this weird stigma of like, why do you want to put a finger up my butt? But when in reality, they may be like, no, you should, if you think that you need to check this on me, I want you to do it because I want to know my baseline pre-pregnancy, pregnancy and postpartum. And I think a lot of people will appreciate that you offered it as an offering rather than like telling them later, like, oh, here we are, we're postpartum. You've got something called a rectocele. I don't know if you had one before because we never offered you a rectal exam. And they'd be like, well, what the heck? Why didn't you offer me a rectal exam? Right? Like, what if I had this
Mm.
before? Because I have a childhood history of constipation. I don't know. Did the birth make it worse? Did I? Yeah.
Oh,
Why?
that's actually interesting. I actually never thought about doing that.
Yeah, it's important to check because, like, I find, especially when there's blame on, oh man, like maybe it was my birth and it generates like almost like a birth trauma where they're like, oh, maybe I did push too hard that one time and
Mm.
it created this rectal seal thingy and now I feel heaviness or like a poop clog. It could have been honestly like existingly there if they had like a constantly straining history, constant like issues with the backside pelvic floor, whatnot, whatever generated. They could have been a grade 1, and then now they're this deemed grade 2, or like now it's starting to show as symptomatic. I think it
Mm.
would be better to let them know, like, hey, you know what? We started out with a grade 2. It looks like you're still a grade 2, but it's symptomatic now. So we got to work on your pressures. We got to work on like managing your poops. We got to work on your motility and like foods you eat, hydration.
Mm.
So I don't know. I think it is important to offer it to each and every person.
Mm-hmm.
And so I will. And yes, there will always be a percentage of people that are like, no, 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 don't go anywhere near there. But for the other group, like they're like, oh, I really appreciate this. Or like, oh my gosh, why didn't anyone else do this? Like my tailbone feels
Mm.
amazing now. So yeah, I think it should be offered. I
Okay.
don't know. I guess that's it. Like those are the things we see not being performed very much by a new pelvic health PT. So don't be one of those people. Yeah, join us at the Patreon for the detailed female male internal exam and what that should entail. And yeah, we'll have another one of these convos with coffee between two pelvic health physios soon. And yeah, we hope you guys give us some feedback in the comments below, hopefully positive things. But yes, constructive criticism is very much welcome. Um, yeah, if you guys want to drop a comment on how this went, what you want to hear more of, what the next topic should be, let's, yeah, open up the floor to you guys. And we hope you guys also give us a like and a follow down below, or a subscribe, not a follow, a subscribe. We're new to YouTube. I don't know the words. Yes, a subscribe below. Anything else you wanted to add, Cindy, or any advice for new pelvic health PTs starting out doing internal
Well,
exams?
just be confident. Just be confident.
Just be confident, fake it till you make it kind of thing.
Well,
Just,
like you know the information, just be confident and you
yes,
know that you can help
yeah,
this client. So, yes.
yes, I like that.
Mm.
My advice would be, if you feel you need the extra support and you're second guessing yourself a lot and you feel like really gross after doing the internal and you're like, oh, I think I messed up, get a mentor. That's what I would say. Get a mentor. Because I feel like if I was a solo practitioner, I think you were a solo practitioner as well, right?
Yeah.
In alone in the clinic. It was really isolating and I second guess myself like almost every day. So it would have been beneficial to have some reassurance from a mentor.
Hmm.
And yeah, Hopefully we'll
Absolutely.
offer more of those services in the future.
Mhm.
Yeah. Okay, cool. Thank you guys for watching all the way till the end. If you made it here, holy crap, thank you. Thank you.
Thank you
You
for
love us.
watching.
Okay. Stay tuned for the next video and yeah.